And we're going to finish this lecture with viral and fungal infections that can infect lower respiratory tract. We'll start with influenza or flu. You already know that there are three types of influenza virus, type A, type B, and type C. Types B and C infect humans only, and type A has what we call wide host range. Means type A influenza virus can affect pretty much everything: humans, animals, reptiles, birds. Usually we have outbreaks in the cold time of the year, in the winter, early spring. The source of infection will be infected individual, and infection is transmitted by respiratory droplets. Influenza virus can mutate, and for your exam you have to know two types of mutations that can be performed by influenza virus. Those are antigenic drift and antigenic shift. Antigenic drift is a mild or gradual mutation which happens every season. As a result of this type of mutation, a new strain of the same virus will be formed. Antigenic shift is a major mutation, and only type A influenza virus can perform antigenic shift, and as a result of antigenic shift, completely new, usually very aggressive virus is formed. Symptoms. The incubation period of this infection is a few days, and then patients develop sudden high fever, chills, headache, muscle aches, cough, runny nose, conjunctivitis. The question is, what is the main difference between the symptoms of influenza and the symptoms of common cold? Because symptoms are pretty much the same. Please remember, if a patient has influenza, usually infection has very rapid, sudden onset, and all symptoms come at the same time. When patient has common cold, symptoms usually come gradually because common cold has gradual, slow onset. Of course, there is no specific treatment because it's a viral infection. Treatment will be symptomatic or supportive, and usually patients recover within 10, maximum 14 days. Of course, vaccines are available every season. Bronchitis. It means an infection of bronchi. We start with croup, or we can call it laryngotracheal bronchitis, because those areas of respiratory tract will be affected. Croup is caused by para-influenza virus. Usually affects children. The source of infection will be infected individual. Infection is transmitted by respiratory droplets. Usually we have outbreaks of croup in the fall when air is dry. Symptoms. Besides the general symptoms of intoxication such as fever, headache, muscle aches, patients will develop very specific loud barking cough. Why do patients develop this very specific loud barking cough? Because this infection causes inflammation of the airways, and also it narrows airways at the level below local vocal cords. There's no specific treatment for this infection because infection is caused by virus, but what will make those patients feel better is humidifier, or you can take the child to the bathroom and open the warm water shower in that room, and it will make patients feel much better. Infection is self-limiting, but please remember, usually patients do not develop immunity against parainfluenza virus, so it means infection can be recurrent. Next infection is called bronchiolitis. Bronchiolitis usually infects or affects small children, infants. It is caused by respiratory syncytial virus or RSV virus. As I said, affects infants, small children, and transmitted by hand contact. Means medical workers can transmit this infection from child to child if they don't follow rules of precautions rules. The main symptoms of this infection will be fever and dry cough and difficulty breathing, and therefore a lot of those patients will need oxygen. There's no specific treatment, and also this infection, as same as the previous one, is recurrent because usually after recovery children do not develop long-lasting immunity against those viruses. The next virus that also can infect lower respiratory system is Hantavirus. Hantavirus causes what we call pulmonary syndrome. You see, it's a fairly new infection. We had an outbreak in 1993 when 70% of victims died. Keep in mind, those are healthy individuals that got infected with that virus and died. Source of infection will be animals, for example, deer, mice, rodents. People usually get infected when they inhale this virus, and as I said, mortality rate of this infection is pretty high, 70%. So what is the cause of death? Unfortunately, this virus causes damage of the capillaries that supply alveoli within lungs. So basically, when those capillaries get damaged, they start leaking and fill out spaces of alveoli. Basically, those patients drown. And again, there is no specific treatment for this infection. Since it's a viral infection, treatment will be symptomatic. Next infection is a fungal infection, and it's called histoplasmosis. Histoplasmosis is caused by Histoplasma capsulatum, which is a yeast. Certain areas in the United States are affected by this fungal infection more often than others, and that is going to be high Mississippi River Valley, means area where we live. So 80% of population living in our area actually is 80 seropositive to this fungus, and the source of infection will be soil with the bird droppings. Birds are not source of infection, but bird droppings actually support or stimulate growth of this fungus in the soil. So how people usually get infected? When they inhale this fungus, when they're working in the barns, for example, in the attics, when they work with the birds. For healthy individuals, this infection is not life-threatening, and you see only 1% of infected individuals will develop symptoms, and most of the times those are flu-like symptoms, not life-threatening condition, and those patients usually develop recover without any specific treatment. But as always, fungal infection is a very serious infection for immunocompromised patients because in their case, infection can go systemic, can cause symptoms that are very similar to tuberculosis. And of course, in that case, we're going to use antifungal drugs for treatment. And for example, as example, we can use amphotericin B. On this slide, you can see what areas can be affected by histoplasmosis. It's a blue area. So you see Indiana, Kentucky, Ohio, one of the states that will be affected by histoplasmosis. But if you look here on the left side, there's a green area. That area shows you that area can be affected by Coccidioides immitis or coccidioidomycosis. Now this is the next fungal infection we're going to talk about. So, coccidioidomycosis is caused by Coccidioides immitis. This fungus lives in dry, hot climates. That's why it usually affects California, Mexico, South America. It grows in the soil, and in the soil it forms what we call arthrospores. Why do we call those spores arthrospores? Because they can stay in the soil for 100 years. How people get infected? People get infected with coccidioidomycosis when they inhale those arthrospores. When arthrospore is inhaled within lungs of that person, it will develop into what we call thick-walled spherules. Within that spherule, a lot of new endospores will be formed, and then where they're mature enough, they leave that spherule, and each endospore will form new individual spherule. And once again, for healthy individuals, this infection is not life-threatening. Those patients usually recover from this infection without any additional specific treatment. But for immunocompromised patients, this infection, of course, is very serious and life-threatening because those patients might develop symptoms that are very similar to tuberculosis. Those patients can develop symptoms of meningitis, fungal meningitis. Means in their case, infection might go systemic. So once again, for those patients, of course, we're going to use amphotericin B as a drug of choice. Next fungal infection is blastomycosis. Blastomycosis is a fungal infection that affects actually humans and animals. It is a yeast, and actually the most cutaneous, the most common form that usually affects animals and humans will be cutaneous form. Usually patients develop wart-like lesions on the surface of the skin. But for immunocompromised patients, again, this infection goes systemic. Patients develop tuberculosis-like symptoms, and for them, this infection can be deadly. And the last fungal infection on this slide we have to know for your coming exam is pneumocystic pneumonia. Pneumocystic pneumonia is called pneumocystic pneumonia because this fungus, Pneumocystis carinii, actually forms cysts within a patient's lungs. We do not pay attention on this infection before we start having patients with AIDS because for healthy individuals this infection is not very dangerous. But after the 1980s, when we started having patients with AIDS, we started paying attention, close attention to pneumocystic pneumonia because this is one of the most common causes of death in patients with AIDS.